With 1 second of pain comes hope that the ordeal of the past year can be consigned to history. British people started receiving the AstraZeneca vaccine a week ago, and this week it's hoped the rollout will gather pace. The UK is being urged to vaccinate 2 million people every week.
I think it's feasible. The best analogy is probably the flu program, which delivers an enormous amount of vaccines, I think about 1 million a week. But we have to double that. And we need to make sure that there are no hitches in the supply chain.
The AstraZeneca vaccine is made at 2 factories in England and another in the Netherlands. Large quantities of the liquid are then taken to a specialist in Wales and another in Germany to divide it into vials. Because it's only received emergency approval, each batch must be quality tested at a government lab before it's dispatched to vaccination centres around the country.
There's a lot of different parties that are all feeding into that supply chain to get from factory to a patient's arm in the end. So it's a massive coordination question. Big vaccination campaigns, humanitarian organisations do these quite frequently around the world. But we've never had anything of that scale where the entire globe basically needs to be vaccinated at the same time.
Because the AstraZeneca jab can be kept at normal fridge temperatures, it opens up many possibilities. From local doctor surgeries to big, currently unused event centres where the army will help organise. And many of the smallest local pharmacies have plans to rise to the occasion.
I looked across the road, I saw the school, and I said, this seems like a potential site. And the school said, yes, we'll be having 2 vaccination stations, a monitoring station. We can do about 300 people a day.
This pub chain has volunteered its shuttered premises to administer vaccines. This supermarket has offered its chilled trucks. But such generosity is not always useful.
It comes back to a question of coordination. How many different parties have we got, and can we all align them? Or does it take more effort to try and coordinate all of these individual bits and pieces than it's actually worth?
The British government says its goal is to reach everyone in its top 4 vaccine priority groups by the middle of February. That's people in care homes, everyone aged over 70, frontline healthcare workers and the clinically vulnerable. Success depends on the supply chain working as planned. But like so many things in this pandemic, that can't be guaranteed. Ty Genwright, Euronews, London.